Hi, this is Mary Claire Speckner with the Bartholomew County Public Library. Welcome you to tonight's program, Just Breathe 360 Degrees. And I want to recognize Stephanie Merrifield at our Digital Underground, who is taking care of the technical aspect of tonight's program. Our presenter, Aubrey Jackson Connor, is a Columbus native and is a doctor of physical therapy. Aubrey received her undergraduate degree at College of Charleston and her doctorate from Rosalind Franklin University. She practiced in Bend, Oregon for 2 years prior to moving back home. Aubrey has had a practice in outpatient orthopedic setting for 14 years, and her special focus is spinal health. And these days you can find Aubrey at Flourish here in Columbus, which has to do with physical therapy and wellness. And now over to you, Aubrey.
Thank you, Mary Claire. Welcome everyone to this presentation tonight. I'm going to go ahead and share my screen here. There we go. Mary Claire shared a lot about my background. I'm a Columbus native, and my friend and colleague and I are both doctors of physical therapy, and we recently opened up our new practice called Flourish Columbus. Flourish Columbus is a dream that Kelly and I came up with last year, really focusing on patient-centered, patient-driven care that is accessible to all of our clients, is cost-effective, and can guarantee a one-on-one personalized approach, as well as a holistic approach to healing the body with musculoskeletal disorders and conditions. As we discovered our style of physical therapy and how we wanted to implement our concepts of physical therapy to our holistic practice, we developed these foundations to flourish. And this was something that Kelly and I found that we were teaching almost all of our clients, no matter if we were seeing them for an ankle injury, a shoulder injury, spine pain. And our foundations to flourish are these concepts that we really feel like help assist the body in healing from a musculoskeletal condition. And these would include breath work, core strength and activation, alignment, and awareness. And so tonight we're going to start off by teaching you about one of our foundations to flourish, which is breathing, and the importance of breathing in 360 degrees. And we're going to talk about that. So we're going to start off just talking about breathing. A lot of us don't really think about breathing too much. We just do it, right? So we don't think about how it works, how our bodies do it. We just do it. The only way we really notice our breathing is if maybe we become short of breath or we get winded. Those kinds of things really bring our awareness to our breathing. But breathing is a basic necessity of life. And it's not just the lungs that are doing the work with breathing, but multiple systems that are working together to allow the act of breathing to occur. So respiration, when we talk about respiration, and this is on the pulmonary level of what's going on in your lungs, you are exchanging gases. So we're taking in oxygen from our environment and we're getting rid of carbon dioxide, okay? And when we talk about inhalation and exhalation, we're actually talking about the act of breathing in as we inhale and the act of exhaling to breathe out as we get rid of that carbon dioxide. Oxygen is essential for every cell in our body. We have to have oxygen for our cells to live and to thrive. And there's a musculoskeletal component to breathing. There's also a cardiovascular component to breathing, because once our lungs pull in that oxygen, then our blood carries that oxygen to our many different cells. Couple of different things that we're going to talk about tonight are, so what is happening in the musculoskeletal system as we're breathing? What kinds of things can happen when we're not breathing and using breathing patterns that are effective and optimal? And what can we do to restore healthy breathing and alleviate some of the symptoms that come along with faulty breathing mechanics or patterns? Ventilation is a term that kind of uses all of the body systems and their effort in breathing. So we've got this pumping system that requires a balance of pressures in our belly and in our chest cavity. We also have muscle activation and coordination. We have joint mobility going on, as well as the lungs doing their part to bring in that oxygen for our cells. When we're just resting, sitting down, not doing much of anything, our muscular skeletal system will contract specific muscles that we call inspiratory muscles or inspiration muscles to help the lungs as they draw the air in. And then when we exhale at rest, when we're just sitting there resting, those inspiratory muscles or those inspiration muscles will then relax. Now, the breathing mechanics changes a little bit when we start to become active. So when we're walking, when we're working, when we're loading our body in fitness or in daily activities, we get a little bit of a different pattern that occurs. So you still have that contraction of inspiratory muscles to pull the air in, but you also have a contraction of some different muscles to help expel the air out. Our primary inspiratory muscle is our diaphragm. And so here we have a nice illustration of what that unique muscle looks like. And if you take a look at this muscle, I mean, a lot of us have heard of the diaphragm, but this is just a very unique muscle. The diaphragm is a dome-shaped muscle that at rest rests in this dome-shaped position. As we inhale, it will contract and then move downward into our abdominal cavity. As we exhale at rest, it will relax and go back to its dome-shaped position. So some other muscles that help it pull air in are muscles found between the ribs. We don't have those shown here, but some intercostal muscles, as well as some other muscles that aren't shown in this diagram, some neck muscles that we find on the front side of the neck that come down and attach near the collarbone. Those muscles are meant to help the diaphragm. They aren't meant to do all the work by themselves, but to assist the diaphragm in pulling the air in. Expiratory muscles. So when we go to exhale, and we're active, right? We're doing something. These expiratory muscles are going to help us with that exhalation process. But not only does it help with expelling the air and balancing the pressures in our chest and our belly, but it also helps stabilize our core and our spine. So these muscles include some other muscles found between the ribs called the internal intercostals, your abdominals, and believe it or not, your pelvic floor. So in this particular diagram that we have here, we have removed all of the abdominal wall, and now you're just looking inside at the muscles found kind of on the back side of that abdominal cavity. So obviously we've removed your abdominal organs in this illustration as well. But what you can see is this nice dome-shaped diaphragm and its many connections to hip muscles that extend into the pelvis and the hip, as well as its connections to the pelvic floor. Now, we've talked about how breathing isn't just your pulmonary system. It's not just your lungs, okay? So we've shown you how the cardiovascular system helps with breathing by transporting the oxygen. We've discussed how muscles help pull the oxygen in and expel the pressures and the carbon dioxide out. But there's also a nerve component to this, right? Our brain has to tell our body to do all of these things, and it does that through nerve connections. So we've got the right and left phrenic nerve, which branch off of upper cervical nerve roots. And those are found kind of higher up in the neck, where we have these nerve roots that branch out from our spinal cord and then continue to branch to innervate different areas of our body. As well as another really interesting nerve called the vagus nerve. And the vagus nerve is a cranial nerve. And what that means for us is that means that we have this direct connection between the brain and some other structures. And so the vagus nerve actually connects from the brain to the neck, to the heart, to the lungs, to the gut. It also plays a really integral role in our body's recovery from stress or stressful situations. And even when we lack a good recovery response from stress, that vagus nerve plays a role. Dysfunctional breathing can result when joints and muscles are not working properly. And we're going to talk about that in a little bit. So here we have another really great visual of some of those specific muscles that we were talking about. So our inspiratory muscles, you're going to find over here. So you've got those neck muscles, and here you can see these assisting muscles, right? When we're inhaling or pulling in air. These muscles are meant to help the diaphragm. Okay, so we've got the scalenes, the sternocleidomastoid. Again, we're going to go down here to some little muscles between the ribs. And then here you've got this illustration of the diaphragm. On this side of the diagram, we've got the expiratory muscles. Okay, so when we're active, we're using different muscles to exhale. And those are going to include some more different muscles between the ribs, your internal intercostals, your abdominal muscles, and this doesn't show, but your pelvic floor as well. So we're going to dive a little bit further into each one of these special muscles and tell you about what else they do on top of helping us with our breathing. So we talked about the diaphragm being a main breathing muscle. It's the powerhouse breathing muscle. It does most of the work when we're inhaling. But it also plays a big role in core stabilization and core strength. And when we're talking about core stabilization and core strength, we're talking about protecting our spine, okay? And that's because it directly attaches to the spine. So you can see here in this illustration, we've got the diaphragm from the side view, okay? It attaches to the spine. It also attaches all the way around the bottom 6 ribs and to the front of our sternum on a little bony notch we call the xiphoid process. So it has connections 360 degrees around the base of your rib cage, and it attaches to your spine. We talked about how it's dome shaped. And when we're inhaling and it's contracting, it's going to drop down into this abdominal cavity. And then when it relaxes, it will return to its normal dome shaped state. Okay. Another group of muscles that's really, really important in breathing is the abdominal muscles, okay? And so we talked about how when we're really loading our body or when we're active, those abdominal muscles help to stabilize pressures in our abdominal wall as we're exhaling and help force that air out. So our abdominals are going to contract with exhalation during activity to assist the diaphragm in expelling the air out of our body. And again, we all know, and a lot of us have heard, that our abdominals play a really big role in core strength. Knowing that core strength usually equates to good spinal health. So pelvic floor, we mentioned this briefly earlier. The The pelvic floor plays a very important role in breathing. And I showed you earlier in that illustration the connections between some of these muscles that help us with breathing. Okay. The whole base of our pelvis is muscle, and that goes for men and women. During resting breathing, when we inhale, the pelvic floor relaxes down. And when we exhale, it goes back up to its natural resting state. When we start to become active in our daily activities, that exhalation is going to be a little bit more forced, and we're going to get a little bit more of a pelvic floor contraction when we're active and breathing. We all know about core strength. I've mentioned it a couple times, but believe it or not, your pelvic floor actually plays a huge role in core strength and pelvic stabilization. It also plays a role in supporting your pelvic organs and pressure management in your abdominal cavity. Another group of important core stabilizers that help protect the spine and play a role in healthy breathing mechanics are your multifidi muscles. And so those are illustrated here. These particular muscles are known to provide stability to each individual joint in the spine. So more localized stability, whereas some of these other muscles we've been talking about today are more of a global stabilizer. Some other areas that we really need to be activated and moving appropriately so that we have good breathing mechanics is our entire spine. I showed you all of those muscles earlier. Feel free to go back and check those out after we're done with our presentation today. But those muscular connections connect to our neck, to our thoracic spine, our ribs, and our low back and pelvis. So we really need all of those joints throughout the entire spine and pelvis to be moving well to promote healthy breathing mechanics. So we're going to move a little bit out of the anatomy physiology piece, which I can't help but love because that is what I do as a doctor of physical therapy, is try to solve these, if you will, musculoskeletal mysteries and try to help people feel really good and get back to moving well. We're going to talk about, well, what contributes to dysfunctional breathing and what is that? I mean, what does that mean? Because we've not really ever paid attention to our breathing before. So when your diaphragm is not moving effectively, it's a muscle. So it needs to have good flexibility and good strength. And when it's lacking in one of those two areas, it's going to affect your breathing mechanics. Poor coordination of all of the muscles that we've discussed, whether that be in your neck, your rib cage, your abdominal wall, your spine, or your pelvic floor. If we have poor coordination of these muscles and they're not contracting and relaxing when they're supposed to, it's going to affect your breathing mechanics. Tension and hypertonicity, so tightness, right? Tension. A lot of us, especially in this 2020 year, I think have felt an increase in stress and tension in a lot of different areas of our bodies, and it wreaks havoc on us. Chronic stress wreaks havoc on us. And so hypertonicity or tension in any of those muscles that we described earlier can affect your breathing mechanics negatively. Typically, these areas of stressed posture will cause tension in the neck muscles, tension in the upper thoracic spine, and the upper chest. And it also negatively impacts the diaphragm because we are not typically using the diaphragm to its maximal capacity when we're holding tense postures. Decreased spine mobility and rib mobility. So the thoracic cage is kind of like your armor, right? It's your bony armor that helps protect your heart and your lungs. So it's meant to be somewhat more rigid than your neck or your low back, but it still needs to be able to move. And when it's lacking in mobility, whether on the spine level or at the rib attachment level, it's going to affect your breathing mechanics. Poor postures. So repetitive poor postures, chronic stress to the alignment of your spine will affect your breathing, okay? And so typically that forward shoulder, forward head posture really doesn't allow you to open up through your chest and the front of your rib cage as well. And so poor postures over a long period of time can negatively impact your breathing mechanics. People that suffer from chronic sinusitis, they're typically mouth breathers. When you breathe through your mouth most of the day, or as a habit, or because you don't feel like you get good, clear airways through your nasal passages, it puts you in a forward head, forward shoulder posture. And then that perpetuates the spiral effect of negatively impacting your breathing mechanics. And those kinds of parafunctions or dysfunctions that can kind of spiral into that may include clenching, teeth grinding, nail biting, lip biting, airway issues. So all of that can contribute to dysfunctional breathing as well. Pregnancy. So when women are growing babies, the baby has to have space to grow, and we want that. And so it's going to take space wherever it can. And so typically the baby will grow and then push out on the ribs, flaring the ribs out a little ways. And usually, and then also overstretching abdominal muscles and putting a lot more pressure on the pelvic floor. And so when the baby does that, it changes a lot of the coordination of those muscles and the mobility of some of those joints. A lot of the times after the baby is born, you need a little assistance in restoring those abdominal activation patterns, as well as bringing those ribs back down, decreasing that flare and restoring healthy movement to the torso. So physical therapy can be really helpful with that. Pulmonary conditions. So people that suffer from COPD and asthma, it's a lot, it's a taxing condition to have on the pulmonary system, yes, but then it negatively also impacts how their breathing mechanics are from a musculoskeletal standpoint as well. So that can also contribute to dysfunctional breathing. Abdominal and core weakness. Kelly and I see a lot of people who have suffered from separation of their abdominal wall and core strength deficits, and all of that plays a role in their breathing mechanics. History of abdominal surgery. It can be a minor abdominal surgery, or it could be a very significant abdominal surgery. But anytime that there's entry into those muscles found in the front of the abdominal wall, you're going to have the risk of connective tissue, scar tissue, adhesions forming, and then this tendency to either compensate for that or guard that area. And then ultimately you don't restore normal, healthy tissue extensibility to those abdominal structures, and that can negatively impact your breathing. Pain. When we're in pain, especially if we've been living in chronic pain, or even if it's a sharp, significant pain, we tend to hold our breath. We're afraid it's going to hurt. We're afraid to move because it's going to hurt. And so that can, over time, create negative breathing habits. Pelvic floor dysfunction, we talked about those connections. Definitely things like prolapse, pelvic pain, incontinence, any of those things that we see people here at Flourish for pelvic floor dysfunction can play a role in breathing mechanics as well. And then finally, stress, anxiety, and depression. And we talked a little bit about this earlier with stress postures, but any of these things can be linked to dysfunctional breathing patterns. So what might I feel if my breathing mechanics isn't as effective as I want it to be, or as ideal or optimal as I want it to be? Well, I might suffer from neck pain. I might suffer from headaches, TMJ disorders, spine pain, back pain, shoulder pain, rib pain, abdominal pain, reflux that's not really getting better with any medication. Some people will complain of, difficulty swallowing, or they'll feel like there's something stuck in their throat and the doctor's seen them and there's nothing there. And it very well could be a musculoskeletal component. Pelvic floor dysfunction, like we said, so incontinence, pelvic pain, prolapse. A lot of these conditions can be a result or be connected to dysfunctional breathing. And some of these things you do have to go to your doctor for first, because how often do we go to our doctor first because of abdominal pain? Well, that's like our first place we go, right? And sometimes you go and they just can't find anything wrong, and they've done all these tests. And at the end of the day, you still have abdominal pain. It very well could be diaphragm muscle restrictions in those upper attachments by the upper abdominal area near your ribs. So just some things to kind of stimulate a little thought outside of our normal little box, that musculoskeletal components can create a lot of these symptoms for people, and physical therapy can help. So what are the benefits of improving breathing mechanics? Well, hopefully you'll kind of have some of these ideas already swirling around in your head with some of the information that we've already presented this evening. But if I can improve my breathing mechanics, I'm going to improve my posture and my alignment. I'm going to be able to really get maximal amount of oxygen to my body, which is going to help my body function better overall. Improved sleep, better stress management, and better emotional wellness. Probably better physical fitness performance because I'm able to core activate better. I'm able to be stronger in my core. I'm able to utilize my breath for power and to get more oxygen to my muscles. Better postural and core strength. Improved coordination, activation, and awareness of my body. Better pelvic floor health. Better bowel and bladder function if that was an issue for me prior to improving my breathing mechanics. And most definitely, a lot of times, by restoring healthy breathing mechanics, we can alleviate muscle pain and joint pain, especially if there is a correlation between those two things. How can I improve my breathing mechanics? So if you're listening to this right now, you're already starting the process because education is the first thing. Again, we don't think about our breathing very often. And when we go to, see someone about pain, breathing isn't necessarily something that's first on their thought process when they're trying to differentially diagnose what might be causing my pain. But what we found in physical therapy is that restoring breathing mechanics, it affects the body in so many different ways, and it most definitely can alleviate pain and improve movement patterns. Physical therapy, obviously, when you come to physical therapy, we're going to release areas that are restricted. So if there is restriction in muscles in the neck, we're going to be able to release those for you. If there's muscle tension or holding between the ribs or lack of rib mobility, we're going to be able to treat that for you and restore healthy movement and flexibility of those muscles. Same thing with the diaphragm, as well as the pelvic floor. Kelly Wiesner, my business partner and co-founder of Flourish, has been specially trained in pelvic floor physical therapy. And so she knows how to release tension and trigger points in that area of the body as well. Meditation and awareness, right? Going back to being aware of how we're breathing and knowing how to calm our breath, maximize our breath. Many studies have shown that meditative breathing and just breathing in general, especially nice, deep, slow breathing, can help bring down the heart rate, decrease the blood pressure, and really help calm and relax tension in our muscles, right? Which also helps reduce stress. Flexibility training. So if there's muscles that are tight and they're not able to be flexible, we're going to improve their flexibility. If they're weak, we're going to improve their strength. A muscle is only at its strongest and best performing capacity when it has the right amount of tension as well as the right amount of length. Mindful movement we talked about. And, at Flourish, we teach this to everybody. It's one of our foundations. So it doesn't matter if you're coming to us for physical therapy. It doesn't matter if you're coming to us for specialized personal training or to one of our fusion fitness classes. Everybody gets education on how to breathe. And we learn how to assess ourselves and our breath. And we provide exercises to them that helps promote healthy breathing mechanics. And it doesn't matter if we're seeing you for ankle pain. It doesn't matter if we're seeing you for neck pain. Everybody learns about breathing 360 degrees at Flourish Columbus. Also at Flourish Columbus, I think it's really important for us to let people know how collaboration really makes a difference in our clients' lives and our patients' lives. So collaboration truly does cure. We can't be everything to everyone, right? And so we know that. And so we have worked really hard at Flourish Columbus to develop a network where everybody's talking to one another. So we're in collaboration with your chiropractor, your dentist, your nurse practitioner, your physician, your massage therapist, and even your fitness professionals, because we want you to feel good. And if everybody's on the same page and they're communicating to one another, then our patients are going to get better faster, right? So if I go to my doctor and I'm suffering from abdominal pain and we've done all the tests and we've tried all the medicine, and say, for instance, my abdominal pain is worse when I'm moving, or it's worse when I've been sitting in a prolonged posture for too long. The key is for that healthcare provider to think of physical therapy or chiropractics or massage therapy and bring that conversation to the forefront so that that particular patient or client can get where they need to be. And same thing on our end. If we're seeing someone with abdominal pain and it doesn't seem musculoskeletal, there's definitely some, other body systems, some GI stuff going on that we feel like is out of our scope of practice. Guess what? We're going to refer you back to your doctor. Fun facts. Flourish Columbus, definitely, we see a lot of women at our clinic, and we love treating and helping women feel good and be successful. But some fun facts for us ladies, okay, about our physiology and breathing. So women have a slightly smaller heart and lungs than men. And typically also women have a slightly lower diastolic blood pressure, which then means that less oxygenated blood is pumped with each heartbeat, which means we breathe more often and we use more energy to breathe. So our respiratory muscles have to work even harder to really optimize our oxygen. And we're up for the challenge, trust me. So we're going to transition so we've talked a little bit about the muscles and the joints that are involved in breathing, right? It's not just your lungs, it's your nerves, it's your cardiovascular system, and there's a lot of muscle and joint work going on for us to be able to breathe, okay? We talked about dysfunctional breathing. What happens to result in dysfunctional breathing? We talked about, well, what can happen if I improve my breathing mechanics, and what symptoms might I be feeling that might be related to poor breathing mechanics? Okay, so we've taken you through that journey. And what we're going to move into now is being able to self-assess. So we're going to all go through together, and we are going to be able to kind of assess ourselves and our breathing and feel and be aware of what's moving and what's not, okay? So typically in our fusion class, or if someone comes to me for physical therapy and I'm assessing their breathing, I will have them place their hand kind of over their heart, and I will have them inhale through their nose and exhale through their mouth. And as they do that, I want them to feel what's occurring in the top of their chest wall, okay? So when they inhale, I should feel a little rise, and my hand should come up and forward with that inhale. What I don't want to see is the shoulders rising. I don't want to see this with my inhale. This means I'm using all of my neck muscles, right? And I doubt I'm even using my diaphragm. If I'm doing a lot of that with my inhale and my exhale, then my neck is really getting overworked, which is going to result in tension, overworked muscles, and neck pain, most likely. So we feel here first. Do we have a little rise in the top of that chest wall? Does it elevate and come forward and up a little bit? Okay, good. If it does, that's great. Next, what we're going to do is we'll place our hands kind of right on the sides of our ribs, okay? So don't want to be at your waist. You want to be up kind of high so you can feel those individual ribs under your hands. And you're going to inhale and exhale. So as we inhale, we should feel those ribs move outward into our hands. So they're expanding to the sides. So we inhale, and then they come back to resting with an exhale. What's interesting here is we want to make sure that we're feeling that evenly on both sides. Okay, we want to feel equal movement on both sides of the ribs. You might find that one side moves a little bit more than the other, and we see a lot of that here, and that's something we try to address because we want both sides working equally. Another area that I'll check too is the rib angle right here. You want to have about a 90-degree rib angle at the base of the front of your ribs. If it's greater than that, you could potentially have some rib flaring going on and some stiffness in some ribs or some weakness in those upper abdominal areas that might be causing that greater than 90-degree rib angle. So that's something else I look at as well. Next area we're going to check for breath is that diaphragm. So I'll usually have somebody place one hand kind of on the upper part of their abdomen or their tummy, just below their ribs. And then the other one you're going to put kind of right on the mid back, right on that spine. Okay. And so we're going to inhale through the nose again and exhale through our mouth. And what we should feel is we should feel pressure from our back and our belly pushing our hands out. Okay, that's indicating that diaphragm is getting that 360-degree expansion, right? And so that 360-degree inhalation or breathing comes from the diaphragm contracting and expanding through the sides of our ribs, as well as through the front and the back side of our thoracic cavity, right? Or the base of our rib cage. So that's that 360-degree breath. That's what draws oxygen all the way down into the base of the lungs. That's what activates all those muscles correctly to provide a healthy breathing pattern. So what I'll tell people is to think of an umbrella, right? If you want to think of 360-degree breathing, and like we said, it's the ribs move out with my inhale, right? And then my belly and my back move out with my inhale, right? Think of an umbrella. So when you pop that umbrella up, it gets that 360-degree expansion, right? That's what happens to the rib cage, the whole base of the rib cage when you inhale. Okay, you get that 360-degree expansion all the way around the base of the rib cage. And that indicates that your diaphragm is working at its best. A couple things I want to clear up when it comes to exercise and restoring healthy breathing mechanics. This is an example of diaphragmatic breathing. Okay, I prescribed this exercise all kinds of times early on in my career, where I would have them just lie there with their hand on their upper belly and breathe into their belly. Okay, gone to many classes where they talk about belly breathing and diaphragmatic breathing. And diaphragmatic breathing is so important. It is, but it's not just connected to the front of your abdominal wall and the front of your ribs. It's connected to the sides of your ribs. It's connected to your spine. And so we can't just have movement here. So that is why in the last slide, we discussed all the different areas that you need to try to breathe into to make sure that you're getting that full diaphragmatic expansion. So here in the sides of the ribs, as well as belly and back, okay? So on this particular slideshow, I have put a link for our version of teaching diaphragmatic breathing. And it's 360-degree breathing. At Flourish Columbus, we have our own YouTube channel. And so, I mean, it's free. You just go on and subscribe. And there's all kinds of great exercises and little videos that we've posted on our YouTube channel that kind of just educate you on how your body works and how to self-assess and how to kind of figure out what it is you need so that you know where to go when it comes to physical therapy related issues. That is, the meat of my presentation tonight, but I definitely wanted to finish up talking a little bit more about Flourish Columbus and what we have to offer. Obviously, breathing is one of our foundational concepts. Like I said, everyone that comes to see us is going to learn how to maximize their breathing mechanics because we've just found, and evidence has found, that it just can make a significant impact in how a body heals and improves movement patterns, improves performance. It can reduce pain. And so breath work is just so important to us. Flourish Columbus, Kelly and I are both doctors of physical therapy. Like we said earlier, we came together and started Flourish Columbus June 1st of 2020 in the middle of the pandemic. But we were really passionate about it, and things just kept falling into place. And we just knew we wanted to provide this holistic, personalized, quality physical therapy experience, which we were taught in our graduate programs was the foundation of what our profession was striving towards. And, over the past several, I don't know, maybe 5 years, we both have seen how our profession is just it's getting confused, we feel like, as to what we're really here to do. And we're here to help heal people. We're here to help improve movement patterns. We are movement specialists. That's what we do. So at Flourish Columbus, we offer physical therapy for any musculoskeletal joint condition, pain, generalized weakness, balance. And the cool thing about our particular business is even just improved performance. So you can come see us at Flourish Columbus in the state of Indiana. You can go to your physical therapist without a doctor's order for 42 days. So you can come see us for any musculoskeletal issue for 42 days before we really need to make sure that either you need to be referred back to the doctor if it's not a musculoskeletal condition that we can treat, or just to follow up with the doctor and let them know what we're up to and maybe where we want to go from here. We also offer pelvic floor physical therapy. So again, Kelly Wiesner is a doctor of physical therapy, and she's specially trained to provide specialized pelvic floor physical therapy services to her clients. We talked about that connection with breath earlier, really important. We also offer specialized personal training. So a lot of our clients, when they're done with physical therapy, they may be like 75, 80% to their goal, but we know how important it is for them to truly reach their goal. And so we wanted to bridge that gap between being discharged from physical therapy and then being able to truly get back to whatever your goal was, whether that was a fitness goal, a hiking goal, a motherhood goal. We want you to be 100% better. And so through our specialized personal training services and through our fusion fitness classes, we have a way to still mentor and coach our clients all the way to their goals. And that's super exciting. We're very thrilled about that. Our location, we are at 718 3rd Street. You can text or call our phone. So if you have questions and you're a texting kind of person, you can text us and it'll come directly to Kelly and I, and we'll be able to answer your questions. Or of course, give us a call. We allow people the opportunity to come in for a free 30-minute consult. If they just want to talk to us about what they're going through and see if it's something we can help them with, we offer free 30-minute consults to have that discussion. Then you can come in and you can see our location, you can meet us, and you can decide whether or not if it's the right fit for you. We have a wonderful website, explanation of all of our services. You can also email us if that's your preference at info@flourishcolumbus.com. And like I said earlier, we have a YouTube channel. We also are on Instagram and Facebook, where we post a lot of free educational information. We want to educate the community, want to share what we know with our community so that everybody can feel better. Some other things that we are doing right now in the midst of the pandemic, since our numbers have been ticking up and our community is being very responsible at taking some precautions to try to bring those numbers back down. We've definitely taken our fusion fitness classes virtual. We made that decision recently after the health commissioner mentioned that group fitness classes should be stopped at this time. And so we're going to go virtual with our fusion classes. Kelly and I each have our own private treatment room. There's only at a max 4 in our entire space. And so we've stayed masked this whole time. We take all the cleaning procedures very seriously. Our clients have been wonderful at calling us and saying, hey, I was exposed. I'm going to set out for 10, 14 days. People are being really responsible. And so we take it very seriously here. But we also offer virtual telehealth sessions as well. So if you're just not comfortable getting out, give us a call. We can set you up with some virtual physical therapy sessions. The other thing that I think is really important to know is that we have gift certificates. So if you heard this presentation today and maybe it didn't pertain to you, but you know of a loved one who might really benefit from our services, call us. We're selling gift certificates for the holiday season. Give your loved one the gift of health and wellness from Flourish Columbus for Christmas. It's a great idea. Everybody wants to feel good. Everybody wants to be able to give that gift to someone they love. So definitely let us know if you have any questions on gift certificates, because we definitely have those going on going into the holidays. And I just want to say thank you again to the library for inviting me and inviting Flourish Columbus to present. I want to thank you all for listening, and please reach out with any questions or concerns, and know that Kelly and I are very excited to be here in Columbus, providing these services to our community, and we just feel super grateful. So thank you so much.
Thank you, Aubrey. I know I sure learned a lot, and we appreciate taking your time to host us, to take part in our program. I can't talk.
It's a pleasure. Thank you.
Have a good evening. Bye-bye.
Well.